Today I wanted to demonstrate a back treatment primarily from a standpoint of chronic neck pain and carpal tunnel. There's a few things going on, some arthritis from years of overuse, but also a few accidents that have happened over the years. Most frequently, or most recently I should say, being rear-ended in a car about 1.5 years ago, and that's really triggered more constant neck pain, and as a result some carpal tunnel. There's also, and I'll show that, some arthritis in the thumb joint, the basal joint, causing some pain because of the degeneration there. The neck ranges pretty much constantly between a 2 and a 7 on the pain scale. If we're not doing treatments every 2 weeks, it tends to live more in the 7 range, and in that first week after treatment we can typically get it to be fairly comfortable in the 2 to 3 range. So I'll demonstrate some of the gentle acupuncture needling from the Japanese standpoint. Just clean a few of the points that I know I'll be needling here today. With the carpal tunnel, she complains of numbness in all the fingertips of the right hand, and constant numbness through the thumb, index, and middle palm, and some wrist pain. And that's a standard presentation of carpal tunnel when the thumb, index, and middle finger are involved. And then here we can see there's some swelling in the basal joint there as well. Common misconception about acupuncture is that these needles are huge, and that they go in very deep and are painful. Some styles of needles are thicker and do go in farther. In the Japanese style, we use a very thin gauge needle, and the energy is accessible from a very superficial level, so the needles do not have to go in deep where they might cause discomfort for the patient. As you can see from the low back, there's a scar indicating a prior back surgery. The patient also has chronic low back pain as well, and the acupuncture is very good at improving circulation through the area, relaxing the tight muscles, and even addressing some of the adhesions and discomfort from the scar. So the acupuncture is very good at addressing scar tissue and adhesions as well. So I'm looking for tight, restricted areas as far as the scar would go. This point here in the center of the wrist, about 2 inches above the wrist crease, is called PC6, and that's a fantastic point in the treatment of carpal tunnel, as it affects that median nerve. Here we'll also treat the joint. And again, you can see the needles are not going in very difficult at all, very deep at all. So we're also treating the wrist crease, the wrist joint itself, and then a needle. There's actually some atrophy here from the chronic neuropathy, and the acupuncture needle can address the joint and some of that muscle atrophy in the major thenar muscle. We'll do a few points up in the neck area. I can tell just from the tension and sort of the way the patient flinched there that that's a tender spot. And then I'll typically apply an infrared heat lamp on either upper or low back. Today we'll do the upper back because it helps to penetrate, relax the muscle tissue as well, improve circulation, and that'll help the neck, upper back tension, which will also help the neuropathy going down the hand. Thank you so much for watching a little video here on carpal tunnel and neck pain. Please like and subscribe to the channel.